Mr. President, thanks so much for joining us today. First question for you, Mr. President. What elements of Colombia's strategy do you see as being most effective in attempting to reduce the coronavirus impact?
Well, let me first of all begin, Jason, by thanking you, thanking Fred, thanking Adrian, and thanking all the council for inviting me to this series. We wanted to have some major outcomes out of all these decisions. The first, to be able to to contain the exponential growth of the virus. The second thing, to prevent that the health system will collapse. And most importantly, be able to save lives by trying to flatten the curve. So far, I think the policies have been working, and especially when we do the counterfactual analysis with the first models that were designed by the health authorities. And this is a continuous work that we have to monitor every single day. It's the reason why for countries like Colombia, it is smarter to ask drastically and fast, is because we have limited capacities in our health system. We don't have the health system that you have in the States or that the European countries have. All the time that we have been able to save by flattening the curve is also for us to strengthen our capacities and be able to have more testing capacity so that we're more effective.
And Mr. President, as the virus continues to spread across the region, across the world, what's maybe the primary lesson learned in mitigation that you have to share from Colombia's experience?
So the major challenge we face, and particularly developing countries, is that we're fighting for the same elements to face the pandemic that the richest countries are also needing. So this, I consider, is one of the major challenges, and that's why we have to be very smart with the limited toolkit that we have, and that's why we had to ask faster on social distancing, because when we look at the counterfactual, if we didn't take the measures that we have already taken, we will be maybe at 900,000 cases in Colombia, and we will have our health system absolutely collapsed.
I want to ask you, is around the world, leaders like yourself are now thinking about strategies to reactivate the economy. What is your thinking on steps that could be taken to reactivate Colombia's economy while at the same time continuing to protect public health?
I have said that it is an absurd dilemma talking about lives versus the economy or life versus social development. Obviously, there's no economy that will work with bad health or massive losing of lives. But also, if you don't have a vibrant economy, you won't be able to keep on improving the healthcare conditions. So it's a false dilemma. And what we have to think is, how do we make both issues concomitant, and how do we make them necessary, both at the same level for our society? So when I had to take the decision about the national quarantine, that I think is the most complicated decision ever made by a Colombian president, because we're talking about basically shutting down the economy for a long period. Well, the first thing we said is we have to do this in a smart way. So yes, we declared the national quarantine, but we kept open sectors that were crucial for the Colombian economy and for the supply chain. And with that, at least we had 50% of Colombia's GDP that was smartly open. Now, the second thing that we had to face is that in Latin America, our economies, unfortunately, are very informal. So we're talking about that maybe 50% of the working force in Colombia is informal. And then you have people who are at the bottom of the pyramid that will take the biggest hit out of this situation. So what we try to do is have the social safety net very well designed and active to provide the conditional cash transfers to the poorest of the poor. And we send them a cash transfer of around $70 for them to be able to have food in the midst of this situation. So we got to coverage at least 10 million families. That's around 30 million people in a country that has 50 million people. So we try to have the safety net working for them. And we also decided to create a line of monetary support to SMEs to protect at least 90% of the employment. So we introduced liquidity from the central bank, but we also introduced a guarantee program where we guarantee 90% of all the payments that most of those firms have to do to preserve jobs through the banking system. We also issued an 80% guarantee to protect independent workers and other workforce and individuals. And we have also allowed some flexibility in the pension system so people don't contribute to pension for 3 months. They get that cash. So I think when we look at the whole population, I would consider that around 70 to 80% of the population will have access to a certain package for them to go through the crisis.
I want to turn, Mr. President, to Venezuela. How are you looking at balancing the needs of Venezuelan migrants and refugees with other demands at this moment?
Well, Jason, that has been one of the maybe most complicated issues that we have had to deal in the midst of all this crisis, because we have for sure received almost 2 million Venezuelan brothers and sisters in Colombia. And we have been able so far to allow them to access to the social safety net. But since there's no sound epidemiological contagion system in Venezuela, since there is a lack of information in Venezuela, and also since the country doesn't have more than 200 ICUs for the whole population, I had to take the toughest decision, which was to shut down the border. I have instructed the Ministry of Health so that through the Pan American Health Organization, we continue to share our epidemiological analysis and some of the best practices that we have applied. But we have also to strengthen the capacity to attend not only migrants, but also population in the border zone areas. But I must say this in a blunt way, Jason. I think the whole donor community and the international community that had been not too aggressive in terms of mobilizing assistance for the migrants, now in this situation, I think something has to be done.
What might be some of the steps that should be taken from a regional level in Latin America, but also at a global level, to better work together to contain the virus, provide healthcare support, and eventually reactivate economies?
Jason, I must say this maybe bluntly, and we have tried to have a coordination level with the heads of state in Latin America, with Prosur, with the pro tempore presidency of President Piñera. We have had 2 presidential meetings so far where we try to get information out of our experiences, and I think that's important. But honestly speaking, I think at a world level, I think there's much to be done. And I have big expectations about this, because I think maybe this is the most complicated crisis the world has seen maybe since World War II. I think now there has to be a very strong level of coordination and basically trying to look to 3 objectives. One, that we can accelerate a vaccine. We have to run for a vaccine. That's issue number 1. Issue number 2 is we need to find a way where we have cooperation to address the need for certain elements. And we're talking about ventilators, we're talking about ICUs, we're talking about PPE equipment that today it's running out because the world demand is so high.
Mr. President, do you have time for one last question?
Yes, of course.
All right, we'll take one last question via the Q&A, and it's an important question, which is what role can the United States play in helping the response and improving outcomes in Colombia and also in the region more broadly?
Well, I also want to say something very important, Jason. As you know, I lived in the United States for 14 years, and I think the United States has the capacity of passing through these complicated moments and unite and go out stronger. And I see this as an opportunity because, first of all, I believe the United States can help a lot Latin America acquiring technology that it's important for us to face coronavirus. And we're talking about fast testing, we're talking about ventilators, but we're also talking about PPE equipment. Obviously, at this point, the United States is also getting short, but I think in the next months, once the apex in the highest demand areas of the United States passes, I think the United States can play a very important role helping Latin America. That's on pure technology. The second thing is the CDC of the United States is maybe the world best, or one of the world best epidemiological control units, and I think we need to strengthen that capacity also in Latin America when it comes to face this type of diseases. But I think the most important thing is the world economy is going to change, and that change is going to present very interesting questions for the United States, whether there has to be a decoupling in the economic relations the United States has with Asia, and try also to look again and maybe in a more ambitious way to Latin America, since we're closest to markets. So, regionally speaking, I think that decoupling process can also become the greatest economic opportunity for Latin America, but it's also going to be important and crucial for the United States economic and national security.
Well, thank you very much, Mr. President. I think you gave also many ideas for our next conversation that we will hopefully have. And I want to thank you again for joining us.
You can always count on me, and we will be delighted to keep on sharing our experiences, and hopefully we'll be able to endure throughout this process. And as I say, this is an opportunity for the world not to become normal again, but to be better. And so I think we all have to keep that in mind. So thank you so much. And it has been a great pleasure.